Today we're going to be talking about our diagnosis assessment and intervention project, and we had the right CVA. And this group is Rachel Richards, Elena Schnarr, and Abby Wagner. So a right CVA happens when blood supply to the right side of the brain stops, and it can be a hemorrhagic stroke, which is when blood leaks into the brain tissue, or an ischemic stroke, which is when the clot stops the blood supply to an area of the brain. Physical changes that can occur are left-sided weakness, left side paralysis, left side vision problems, left side sensory impairments, left side neglect, facial weakness, balance problems, left side pain, and left numbness.
Cognitive changes include impairment of sensation on the left side, which are touch, pain, perception, and temperature, spatial and perceptual deficits, unilateral inattention or neglect on the left side, impulsive behaviors, quick and imprecise movements, and errors of judgment or problem-solving deficits.
Some emotional changes specific to the right CVA are reduced experience of pleasant emotions, sudden outbursts of emotion, and post-stroke anxiety. And then some emotional changes that occur with CVAs in general include restlessness and irritability, depression, apathy, and the pseudo-bulbar effect, which is when the response of their emotion does not match the situation, like crying at a funeral, laughing during a funeral or crying at a joke.
The first assessment is the Fugel-Meyer, and this test assesses 5 domains, which are motor function, both the upper and lower extremities, sensation of light touch and position, balance, joint range of motion, and joint pain. The test takes 30 to 35 minutes to administer, and the domain areas are all commonly impaired and damaged by a CVA, so it can determine the extent of a person's impairments, and it also can measure their stroke recovery.
For our second assessment, we're going to do the Cognostat, which assesses spatial awareness, language, memory, and their calculation skills. The test time also takes around 30 minutes for the full one, or there's a 5-minute mini version. The test components include level of consciousness, orientation, attention, language, constructional ability, memory, calculations, reasoning, and patient's impression on how they scored and what the examiner observed from them.
Our third assessment is the Catherine-Bergego scale, and that's a checklist that is used to detect the presence and degree of neglect during observation of everyday life activities on a 4-point rating scale. So that's going to evaluate the impact of the unilateral spatial neglect on daily function, as well as their awareness of the impairment. And it involves 10 everyday tasks that the OT observes during their performance. And so some examples of those include whether they forget to groom or shave the left part of their face, whether they experience difficulty in adjusting their left sleeve or slipper, and whether they forget about a left part of their body, for example, forgetting to put their left arm on the armrest. And there is also a corresponding patient or caretaker questionnaire that can be used to assess their self-awareness of the neglect.
Our first intervention is painting. Right CVA clients will utilize paintbrushes and canvases to create images that express their emotions and use their creativity. This intervention can be easily graded, like using different size paintbrushes or canvases, different numbers of paint colors, and different hand-over-hand levels of assist. And this intervention targets many skills that can possibly be impaired by a right CVA, which include fine motor control, crossing midline, visual scanning, sensoromotor feedback, and social participation.
Our second intervention is mirror therapy sensory re-education. The importance is to retrain the brain to appropriately process and respond to different sensation, which includes textures, temperatures, and pain. So you would do the sharp dull test, the light touch test, and the hot cold test on the mirror, and this typically is not done alone. So you could also include doing card games to address spatial awareness, attention, and problem-solving skills.
Our third intervention is constraint-induced movement therapy, or CIMT, which involves restricting the healthy limb using slings or mitts to force the use of the affected limb, promoting neuroplasticity. It's effective for improving motor function in stroke patients, for example, in the left arm for someone who had a right CVA, and clinical improvements translate well to real-life activities, enhancing functional independence, and it can be adapted to various recovery stages. And these are our references.
Thanks.